Good morning, Tim Berios here. I'm an obstetrician and gynaecologist along the north coast of KZN. I'd like to discuss with you a very common question that patients ask me, and the most common question that I hear from them is, when should I actually present myself for my first antenatal visit? I tell them that it's probably the best to come and see me as soon as you fall pregnant. And how do you know if you're pregnant? Well, you've missed your period, you start feeling signs and symptoms of a breast tenderness, maybe a bit of bloating, maybe a bit of nausea. Go for a blood test or even a urine pregnancy test. They are very accurate. And once it comes back as positive, present yourself for an antenatal visit. Before you present yourself, I think the most important thing is to write down everything. All the questions that you want to ask the obstetrician. There's no such thing as a silly question. Ask, ask, ask. At the end of the day, it's your pregnancy. You want the best for your pregnancy. When you do present, it's normally about 6 weeks or so, 8 weeks. And what will happen is, first and foremost, the obstetrician will ask you in-depth medical history from your age to how many pregnancies you've had, were there any miscarriages, ectopic pregnancies. Then they will like to know when your first day of your last menstrual period was, to estimate when your expected date of delivery will be and how many weeks you are. They go through your medical history quite carefully. Why? To see if you have a history of diabetes, high blood pressure, any clotting disorders, things like that, which are very important. Also ask about your past surgical history and whether you've got any allergies that may affect the treatment going forward, like antibiotics. We need to know that you're not allergic to penicillin, for example. They then will listen to a whole lot of questions that you may present, and then from there they will take you through to the examination room, and if you're comfortable with that, they will do your blood pressure, listen to your chest, examine your tummy. Normally when you in early pregnancy, 6 or 8 weeks, we tend to suggest a vaginal ultrasound. The reason for that, we are totally aware that it's uncomfortable, but being counseled before the probe is inserted, it's not as painful at all. The reason we do that is because we can come as close to the uterus as possible, and we check for things like, is the pregnancy in the uterus or in the fallopian tube? Do we see a gestational sac? Is the gestational sac nice and high in the uterine cavity? And from about 5-6 weeks, we can see the little fetus there. And we will listen to the baby's heart. You will hear the baby's heart, which is one of the most exciting things that you'll ever hear. And then we measure the baby from its crown to its rump, which is called the crown rump length, obviously, and that will give us an idea of how far you are. And then the ultrasound machine will generate what your expected date of delivery is. From about 8 weeks onwards, we use tummy scans. Furthermore, after the consultation, the doctor will again listen to any pertinent questions that you need to ask. Don't be shy. Ask, ask, ask. Every time you also come for an antenatal visit, we will ask you to pass some urine, and the reason for that is to check for things such as blood in the urine, leukocytes, infection in the urine, proteins in the urine, and glucose in the urine. The gynae will explain why we are looking for those different elements within the urine. They are important and vital. The first consultation also goes through obstetrics generally. We will speak to you about how frequent you need to come and see us. For example, for the first trimester, up to 28 weeks, it's once a month, 28 weeks to 36 weeks, every 2 weeks, and then weekly. Every time you come, you will have your urine tested, your weight examined, and your blood pressure checked, your abdomen examined, and most important for the patient and for the gynae is to make sure that the baby's growing appropriately. The gynae will go through in the first consultation on what you're allowed to eat and what you're not allowed to eat, what your expectations in the first trimester will be, such as your nausea, your vomiting, etc. They will also discuss the importance of folic acid and may add folic acid with multivitamin or just by itself. Furthermore, they will do a blood test if they have to see if the progesterone level is low, or if you've got a poor obstetrical history, they will do a progesterone level to see if we need to add that. You will be sent for quite a few blood tests, and the reason for the blood tests are to see what your blood group is, to see if you're anemic. We do a few viral infections that is important that may affect the pregnancy. And then at 12 weeks, which I'll go through in the next video, is a very important scan. Remember, it's your pregnancy. Ask as many questions as you can. At the end of the day, the more you ask, the more you get out. I hope I have helped you.